Welcome back to my second video, and I have a disclaimer. I'm not a doctor. Everything I learned by reading and listening. Reading articles on the internet concerning health, overall health, and listening to really great videos on YouTube. Again, if you would like to know what they are, just let me know. I'd be more than happy to share them with you. They're good ones. Got ahead of myself in video one on the virus, but I'm so excited. I kind of got this passion about me. Whenever something new happens to me, I got to research it till I'm done, right? Got DVT in 2007. I did not know what blood clots were, where they came from, the risks. I knew nothing. Okay, fast forward, 13 years, my doctor used to tell me, quit getting on the internet and quit reading. Well, I had to fill myself with information and, know where I'm at. I think we're like that, aren't we, with this virus? We want to know everything. And look how much has changed since the very beginning. We have learned so much. At first they said it was like the flu because it kind of matched up with SARS and stuff. And it's like, no, it is not the flu. It's a very, very new virus, and that's why it's wreaking so much havoc. Our bodies have never seen anything like this before, and they just don't know what to do. Our body doesn't know what to do. To be honestly clear, or not clear, but transparent, I've been kind of stressed out for the last week. I've been kind of wanting carbs, and I've been eating some, but I have been walking the dog and doing a little bit of, exercises. But this is what stress does, right? It kicks in your primal instinct, and you want to survive. And it's like, it kind of makes you want to do, kind of like winter. When winter comes, we're like, oh, survival mode. Stuff's not available anymore. That's primal thinking. Everything's available. I think that's the problem. I wanted to do this video outside, but the mailman was up the street talking. And my old mailman used to do that. He'd have headphones and he'd be talking to the family. And then a car pulled up next door, and I thought, oh, I can't do this. All right, so I said my second video was going to be on the virus. Like I said, it's new. Look how much information, oh, can't see. Look how much information we have gained since then, right? Every day is changing, and that's why I appreciate what President Trump has done coming out with his team. He's getting heavily criticized, and I think it's sad. He is working so hard. Now, had Obama done this with the H1N1, I would be singing his praises, but he didn't. 6 months later, he issued a state of emergency for the whole United States. It was a little too late. Almost 13,000 people died. I'm going to get into the difference from that virus to this virus. It's very interesting, and you may already know this. So it's not the flu. We've had 2,000 years of learning to deal with the flu, and archaeologically, this is proven. They have found viruses in old 2,000-year-old mummies and stuff. And so what this does is anytime you're introduced to a new virus or bacteria, whatever it is, your body learns more and more. It recognizes it, right? It's like, oh yeah, so we're building antibodies. And that's where I wanted to get into the tonsils. It's not next on my list, but I think I'm going to do that next, and here's why. So the tonsils are, there's three sets of two tonsils, and what they do is when we're babies, we're crawling around, we're sticking stuff in our mouth. This is an introduction to the germs of life, and the tonsils, what they do is they go, oh, okay, and they start building antibodies. This is how it works. Your body is, God made such an amazing, perfect body. And so your antibodies build up, and they build up, and they build up, so that the next time this germ enters your body, your body goes, oh yeah, I know what to do with that, right? I love it. Okay, so the tonsils, I didn't have tonsillitis. Yeah, I had tonsillitis, but I had strep throat a lot. when I was in a junior high and high school, mostly junior high, I was sick all the time. Oh my gosh, I hated it so much. Well, I had a doctor that did not want to take out my tonsils. He thought that tonsils were very important and that I needed to just work through it, right? So that they were there as a defense, kind of like your appendix. You know, we go, what are appendix for? What are tonsils for? But this is where you read and you learn what the organs in your body do. So they're our first line of defense, and we want to keep them if we can. Thank you, Lord, for that doctor. Now, my husband, on the other hand, basically like the movie where the kids all go in and get their tonsils out at the same time. That's what my mother-in-law did. All the kids went in. Here's the funny part. I have been sick my entire life. I don't care. Over and over and over and over and over again. Okay, with everything, okay? My husband never gets sick. I mean, never. He never gets a cold. Well, he just had one, but he got over it. Rare. He never has the flu. He never gets anything, which is good. Thank you, Jesus, because he's now the breadwinner in the family. Thankful for that, but he just never gets sick, and he has a hard time sympathizing. When I got the bronchitis that I spoke, 2 videos ago about in Vegas, and I was coughing, he was getting irritated, right? He was getting irritated, and before that with the throat thing, remember? Irritated. Well, he ended up with a cough. After we got home from Vegas, a lot of times, a cough follows the cold. And I said, and he was like, I said, now do you see what I was going through? Now do you understand? And you yelled at me. Stop coughing. Like I could help it. He goes, yeah, I get it. It's no fun. Duh. All right, so that was the tonsils. Antibodies we're building up. Vaccines. There's anti-vaxxers. I think I've made it perfectly clear where I am in that. But let me tell you, what a vaccine is a diluted version of the virus so that your body can go, okay, now we need to build up antibodies to this now introduced new virus, right? That's what a vaccine does, is it helps you. But in children, it actually does the opposite. Okay, let's not get into that. And so the problem with this virus that, there's people who have a compromised immunity. I'm one of them with the lung issues, bronchitis and asthma. And then there's also other risk factors. Tobacco, okay? We kind of discussed that. Smoking, you're killing the good cells in your lungs. Why would you do that? So the virus was attacking the elderly, right? I live in Washington. I don't need to tell you what was happening here. Okay, we had the first case, we had the first death, and it just rolled on into life care up in Kirkland, where many elderly patients passed from this because their immunity is down. Okay, it hits the elderly, it hits the lungs. And remember they said at first, it's not hitting kids. The young, I think they gave the young people, and I want to say, maybe late teens, 20s, and 30s, a free pass to go do what they wanted because, we're not going to get hit by it. We're immune to this. It's hitting them now. And it's because they've exposed themselves to the virus. And, we all know that young people do a lot of smoking. It's not good. And then, of course, diabetes, being overweight, heart. How many people have they said, they had a heart condition, pre-existing, had a heart condition, had diabetes, had cancer, was on chemo, whatever it was. All these come into play with this virus, and probably others as well. Now, the virus has a pattern. I don't care if it was, chickenpox or measles or whatever it was. They peak, all right? You can look at the pattern of all these viruses, and they peak, and then they drop. And it's kind of what they're looking for now, right? How many times have they said, we want to flatten the curve, we want to bring it down. This is what happens with viruses. They have a season, and usually around May is when they start dying off, from May to August. and their peak is over and they're on the downside, and that's what we're looking for. Our bodies are very smart. They know what to do. They know how to build the antibodies. But do we give it the building blocks to do that? No, we don't. What do? We drink pop. We eat chips. We eat Oreos. What is this doing to your immune system? It's killing it. It's causing inflammation. I've been through this with my keto video. You know, I'm not going to repeat it. And you can look it up. I'm not going to preach to you. That's for sure. Now, fever is a way of your body defending this new bug that's coming into your system that is like, wait a minute, we got to attack this thing, right? A low-grade fever is when your immunity is really high and it's really fighting this thing. It's when your fever gets higher and higher and higher that it slows down the immune response. And so what do? We take a pain reliever or fever reducer to get our temperature back down, because we all know that high fevers are not good. And let me tell you, I could spend an hour talking about that with my childhood. Excuse me, my throat. Okay, so the fever is a good thing in a low grade. You know, when it starts building, you do want to protect yourself because things can happen. I went into convulsions at 2 years old. I was in the doctor's office. I was already sick, had a high fever, went into convulsions, and they whisked me back. My mom tells me this story. You all grow up with the stories of your life, right? Mom says, they shot you with epinephrine. Oh, wow, they had epinephrine back then in 1960? I didn't know that. But yeah, so, and then sick, fevers. Ugh. Well, I have tinnitus ringing in my ears. I've had it forever. It doesn't bother me. It's from a high fever. Okay, so let's talk about the virus. The first response is containment, okay? We know that there's a viral infection going on out there. We really need to contain the person. But we're past that at this point. I mean, basically at the beginning we were past it, right? Now, there was a case of Ebola in Texas, and what they did was they contained this person, and it didn't spread. Containment is number one. We're past it. What do we do next? Mitigation, number two. And that's where, excuse me, forgot my glasses. You regulate on how it's showing up. And so what we did was we started, Trump banned flights from China, which was a good first step. But I think, in 2020, we can see, right? And it probably should have been all flights. I think everything should have been grounded because it was, everybody was bringing it in. And now look at New York. People are leaving New York and taking the virus with them. That's not good. That's containment. That's mitigation. And so what we are now is the phase where we're doing what it takes to not spread the virus. And some areas are slower than other areas in doing this. The Trump administration has left it up to the government of each state to do this, right? Washington pretty much acted right away. Here's what we're going to do. We're going to have people not going to all these stores. We're just going to keep the essential ones open. And so that helped slow it. In my community, we have over 100 cases, like 157, 3 deaths, and 9 hospitalizations as of today. And so we want to, slow down the process. It hits, I've mentioned before, the immune compromised individuals who are at risk, people on tobacco or vaping, and obesity, heart, chemo, diabetes, lifestyle factors, right? And so what you want to do is you want to honor your body by feeding it the nutrients it needs to be able to give yourself a fighting chance. I think this is about all I wanted. Keep informed. Don't be afraid to watch the news conferences because they're learning and they're giving us that knowledge. We're learning as they're learning, and we have the best of the best working on this, okay? stay inside, stay safe, and washing your hands breaks that lipid outside covering of C19, and therefore the DNA and the information inside cannot remain. Have a good day.